Hi, it's Dr. Noel Williams at Optimal Health Associates, July 30th, 2026. We want to talk about estrogen. Estrogen has been revitalized because the Women's Health Initiative of 2002 has been essentially abandoned scientifically, thanks to the FDA actually following the science, which it's not necessarily known for doing, but under Dr. Macri, it definitely has been. Unfortunately, he had to resign or was fired by the president for not cocaine flavored vapes, but that's a whole separate story. But the main issue is estrogen's in. It's in finally. It's great for you, but it has to be administered in a certain way. And the way is it has to not be swallowed. If you swallow estrogen, it's your liver in a dollop, and you get a first pass effect, which means you make a ton of protein, some of which are clotting proteins, and a lot of which are proteins that inactivate all your hormones. So that's bad because it elevates your risk of blood clot and makes your other hormones don't work. And then finally, it also makes your insulin go up. So it's the one way you can take estrogen that associates with weight gain. So because of this, we have been using topical estrogen since 1999. I'm glad everyone's caught up to us. So now everyone's using topical estrogens. The problem is there isn't the supply. So the most common topical estrogen administration in the United States has been patches, because all the branded topicals, things like Elestrin, Estradiol, Evamist, are poorly covered by insurance because there's obvious discrimination against women and women's health needs in this country. But because of that, we have to use patches a lot. But there's a patch shortage, and the patch shortage also is compounded by bad products and generics that don't contain any estrogen, which we see constantly when we have patients who start to bleed on their patches and we check their estrogen levels and they're zero, or all of a sudden they're having hot flashes and night sweats or sleep disruptions and all their menopausal symptoms are back, and they're using their patches and we check their estradiol levels and they're zero. There is also a role for checking hormone levels. Some people don't think there is. That's totally wrong. It's vacuous to think that. There's also other ways of doing hormones besides patches. You can do shots. Estradiol shots are very effective, kind of old school. They're a little more pricey than they used to be, also because of supply. Pellets are awesome. That's something that goes under your skin. We use those a ton, and they last for about 3.5 to 4 months at a time. They're not covered by insurance. There's also the Fem ring, which is a ring that goes in the vagina for approximately 3 months. That can be very effective, and its price has come way down, so that's great news. Then we also use the Hormone Replacement Club, where patients will sign up. It's a national organization, and then you can get some pretty good products. They have the Minivel patch, for example, and it's a good product. Unfortunately, it is $48 a month, which is a little more than we would like, but again, it is a good product and fairly reasonably priced. So that's just kind of the thing going on with hormone replacement therapy. It's taking off all over the country. It's going to save thousands and thousands of lives from premature death and lower the risk for breast cancer, lower the risk for diabetes, Alzheimer's, dementia, so many great things. Colon cancer, everyone forgets about. Plus you feel good and you're happy and you can think and you keep your hair and your skin and everything's wonderful. So estrogen's great. If you have a uterus, you need to take it with natural progesterone, but always remember the most productive hormone from the ovary is testosterone. Testosterone is made at the ovary. It actually is the number one hormone of the ovary. You make 400 to 1,000% more testosterone when you're younger than estrogen, but it's still a girl's level, but it is a very important hormone to combine with testosterone or use by itself for women. But again, it's just 2 to 3% of a guy's level. It's not about making girls be guys. It's about giving them their normal hormones so they can live a long and healthy life. That's it from Noel Williams at Optimal Health Associates.